My name's Amrit and I live in England, in Leeds to be specific, and I work in healthcare, so I work in our National Health Service, and I was diagnosed with appendiceal adenocarcinoma. If I think back, there were symptoms, but I can't say they were directly related to this, and they were more along the lines of what, as women, we would think that we're naturally going through, hitting perimenopause and going through that stage of your life. So things I had were severe migraines. I've always suffered with migraines, hormonal migraines, but these were becoming more and more regular and were becoming, I wouldn't have respite between them. So I remember having the migraine for 14 days straight, and it was, I don't even know if it was a migraine, it was a cracking headache. And I remember just being sat in the car after doing a school drop-off and crying in the car and typing out this email to my GP, this consultation sort of email to my GP saying, I don't think I can carry on like this anymore. I was doing lots of things, over-the-counter medicines and things. And I think that's when I sort of thought, it's hormonal and I need to do something about it. One other thing I see now back in hindsight and reflection, and I should have taken note of, was weight loss overall, but an increase in the size of my tummy. I started to look, I'd say 9 months plus pregnant. I was losing weight everywhere else, and it was really odd. And I remember going into changing rooms in shops and clothes and changing rooms, and I'd actually hated my body. And I thought that was related to perimenopause, where women start to lay down fat and, their metabolism isn't what it used to be. So I was reading all this stuff up. There were quite significant changes in my menstrual cycle as well. And I hope it's okay for me to sort of say I had bleeding that was really heavy, but it would go on for sort of 3 days and I would be intensely heavy to the point where I thought, is this the thing they talk about when you Google perimenopause? Is this the change in your menstrual cycle? And it would only last for 3 days, but then on day 3, there would be sort of nothing. But it was almost like, again, I don't want to be too graphic, but it was not sort of a fresh bleed. And even then I didn't think, this is something I need to be looking at. I just Googled my symptoms, working in healthcare in the NHS. And by the way, I was diagnosed in 2022. So we were just sort of coming out of lockdown. So I just kept, being a mum of a young child, kept putting it back and thinking, I can go to the chemist and buy something for this. I can buy something for my headache. Googling the issues with sort of my menstrual cycle and thinking, this is just the change. So there were sort of hormonal things. The other thing I will say massively was my skin. And I've always been one to look after my skin and use what needs to be used on there and do my routine. But my skin went absolutely haywire. I had almost like not a breakout, but it was almost like a rash. And I see some pictures now, and it's just like this rash had taken over nowhere else but my face. But I just thought, this is me going through the change. I'm 40-something years old, and that's it. That's me going through the change, and this is normal, and this is what happens. I think that's what alerted me. Then I went to the GP practice. The symptom I went with was bloating. So along with all of this, I felt that I was severely bloated, and it did feel like I had bloating. So I was on lots of herbal I cannot tell you, I must have rattled with the amount of herbal concoctions I was taking. And I remember going into the GP practice saying, I'm really bloated, and I've seen something in the reception area that says bloating and a change in your sort of periods could be gynae cancers. Like, that's what the symptoms are. I'd like to get checked. So this was in 2022, and I went to discuss HRT because I have had a family history of sort of gynae cancers through my grandma, so my mum's mum. The GP was really clear, and she said that she wouldn't be able to prescribe me HRT without understanding and doing some further investigation. So I went for a scan. And that scan very quickly. I mean, I came home, I got a phone call. No sooner had I sat on my desk to log back onto work, I got a phone call saying, just stop what you're doing. They were quite non-specific, but from the really lengthy letter, they'd found a mass in my ovary. And so I went down then the gynecological cancer route. They didn't say it was cancer at that point. They weren't clear because it looked different. But they found a 7-centimetre mass on my left ovary and called it a complex cyst for some reason. I was then referred on the fast track cancer pathway, which is a 2-week pathway, into a gynae service here at one of our local hospitals. And I presented there, and really they told me what was on the initial scan letter. So they did nothing else. They then referred me 2 weeks later into a different scanning department. So where I'd had a transvaginal scan, they said I needed an ultrasound scan. No, sorry, it was an MRI scan at that point. I needed an MRI scan and they would refer me. So GP tells me, refers me on to consultant at hospital. That takes about over a week. See the consultant in the hospital. He reads out what the scan, the ultrasound sort of showed, referred me on to an MRI. I waited about 2 weeks for the MRI, had that MRI scan. The results went back to my GP. And this was the point at which I was hearing things and terms like a perforation in her abdomen. And I couldn't understand what that meant. And what they said from there was, I remember them saying that those scan results needed to go to the gynae team for gynecological cancers, and it needed to go to one of their multidisciplinary team meetings. So then I waited there for their MDT meeting, which happened every Tuesday. So they would look at all the scans that would need to be reviewed at a multidisciplinary team meeting. And they did that. And I remember a female consultant specialist gynecologist ringing me. She said she'd walked out of the gynae meeting to say that she thought it was something called PMP, pseudomyxoma peritonei, that she'd only ever seen it once before. And I really quickly got an appointment with the Christie Hospital saying, we want to see you within the next week. We've got your scan results back and we need to talk. That was the next step. So I go to this appointment and it's me and my other half, and we're sat in this tiny room. Absolutely. We were in our own bubble at that point. I think the world, all that noise around us just didn't matter. He drew a picture of my peritoneal cavity, because that's the cavity within which all your organs are in. I didn't even know that we had that. He drew a picture of it and said that it looked like pseudomyxoma peritonei. It's like a neoplasm, but he called it something like a low-grade mucinous neoplasm of the appendix, so a lamin, L-A-M-N. And he said that it's low-grade, and he explained that the vast majority of cases are related to a benign lesion within the appendix, but 20% are related to a neoplasm, which is deemed to be malignant. And he sort of said, Amrit, I don't think you're in that 20%. If you think about the math of it, 1 in 3 million, and then it gets smaller, it gets to 80% that have got that PMP. And then, it's really rare that you're going to have that, you're going to be a subsection of that in that 20%. I remember me and my other half shooting a look at each other, and I smiled. I think for that first time in such a long time, I smiled. And he started to talk about the procedure. And he did tell me that the CT imaging, the series of imaging showed that they'd identified an abnormal appendix with evidence of rupture and associated mucin. And that was the perforation they're talking about. The perforation was actually in my appendix. So what had happened was this stuff comes out of your appendix. It sounds awful. It comes out of your appendix, and once your appendix can no longer contain it, my appendix perforated. And then all that mucin started to spread inside my peritoneal cavity, so it had spread inside my tummy. The mucin, he said, had now occupied areas within my pelvis, over the surface of my uterus, in the left flank, over the top of the spleen, and over the top of my liver. In addition, my right ovary looks enlarged. So it was my right ovary, not my left. My right ovary looks enlarged with evidence of a cyst within it, and you have got evidence of disease in the omentum. The omentum, I understand, is the lining of your peritoneal cavity, so that was covered in it. And there's evidence of fluid or mucin occupying the spaces between the loops of the small bowel. They suggested that the most likely diagnosis in the absence of any other pathology was pseudomyxoma peritonei due to a low-grade mucinous neoplasm. And he sort of said that they then gave me a measure based on the volume of this mucin in my tummy on something called the peritoneal cancer index, which gives you a figure, a total out of 39. And what they do is, I think they section your peritoneal cavity into 16 parts. I'm pretty sure that's how he did it. And then they graded each part around how much mucin occupied each of those 16 spaces. And it's a score out of 39. And he said that mine was 20 out of 39. So it had spread quite extensively. I didn't realise at this point that there was a chance that I would not be eligible for this procedure, because if it gets over a certain index, they sort of say there might be nothing we can do. So I was pretty close to that. They talked about various options of the procedure the various options that I had. He didn't say anything, but I saw the consent form, so I kind of knew that he was pushing me towards signing the consent form for option 3, which was go in and have this procedure. He reiterated that they don't have the pathology, a biopsy to sort of say if it was malignant or not. But he sort of said that simply adds another operation for a biopsy. If we're going to go in, we just go in and do it now. He then also explained, and I think this was really shocking for me, he explained that they wanted to undertake after this not after this, but as part of this, it's coming back to me now, something called HIPEC, so it's systemic chemotherapy. So it's that warm chemo wash in your tummy. He says generally it doesn't work, but he would suggest that there are some side effects, but he would suggest throwing everything in the kitchen sink at it. Taking on board my age and that I had a young family, he would give me every chance and every option of having the best of the best treatment. And then he talked about, once he sort of understood that, we were okay with going for option 3, he then started to talk about what the operation would entail. And so he sort of said it would consist of removing all visible areas of disease. And in my case, it would require removal of all the mucin over the surface of my liver, removal of my spleen, because that also has disease on it, remove both of my ovaries. So I've had, I think it's called a bilateral oophorectomy. One's abnormally said, but if they leave it in there, the chances are if it does come back, it'll get contaminated within the other one. So he said, to remove both. They would also remove the appendix anyway, and the structure called the omentum. He said he'd remove that in order to be able to reduce the level of disease to its lowest level. I think in terms of removals, that's all. Oh, and then he said my gallbladder would need to go as well. So they removed that as well. And then he said you'd have heated intraperitoneal chemotherapy using 90 minutes of heated, some chemo drug that I can't even say, to kill off any viable remaining cells if they were there. However, that chemo treatment, the HIPEC, wouldn't dissolve away areas of disease that they were unable to remove. So what he was saying was that this was down to him and his skill. My procedure, I know, was about 9.5 hours, 10 hours. Prior to this, in my pre-op assessment, I'd been marked up as well. A week before, I'd been marked up for where they would put the ileostomy should I need one. And I remember the nurses saying, Amrit, when you start to come round, if you see me at the end of your bed, that means you'll need us. If you don't see me, that's really good. You won't need us. You won't have needed a bag attached to you. So if you don't see me, that's good. And I remember just slowly starting to come round. And I remember the consultant coming round and sort of saying everything had gone well. And I was just eager to know if I had a bag. That's all I wanted to know. And that's so strange. Why would I hone in on that? You know, I've had this massive diagnosis, and yeah, I didn't even see it. So I knew I didn't need this. And the next thing I know, I was sort of in and out of consciousness in intensive care for 5 days. Surgery had gone well. They sent all the bits and pieces off. I call them bits and pieces, but all of the biopsy material off for a biopsy. 8 weeks later, I remember being stood in the shower because I was waiting for this phone call. And she said, I'm really sorry to say it's a mutation and it's malignant. So we are going to have to give you a course of chemo. I don't know what she explained then. I mean, that was it. I remember when I got the first phone call from the MDT specialist, the gynae specialist, I laughed at her when she said, we think it might be gynae cancer. And the only other time I laughed was this time when she told me that it was, I could not believe it. I don't know why I laughed. I couldn't believe what was happening. So yeah, they told me I would need to, when I was stronger, I'd need to get my strength up, but then I'd need to go through 3 or 4 rounds of chemotherapy, IV and the oral chemo. And each cycle, they said, would be given by a drip. And now it did say on my notes over a 2-hour period, which is repeated every 4th week. And then it was followed by tablets, which were taken on the very next day. And they were taken for like 13 or 14 days. I remember going for my first session being really scared. And there was this lovely elderly gentleman that was having his. And he just sat there and he said, don't worry, if I can do it, you can do it. They decided to give me the drip not over 2 hours, but over the course of 4.5, 5 hours. So I'd sit there for sort of 4.5, 5 hours having this drip. And I didn't realise that you could have a port fitted as well, which I probably should have done. The side effects were pretty much immediate, really. The drip going in it had a really odd sensation. I don't know if I should be saying this, but it felt like a burning feeling in my vein. It felt like I could track physically where my vein was. So they needed to give me, it was a heated pad to put on my arm. That was the sort of first symptoms that I had. And then they would say, and then they told me that one side effect I would get from this drip was neuropathy side effects. So because it was during winter months as well, they wanted me to cover my neck, wear gloves all the time, make sure I was wearing thick trousers so my thighs were covered as well, so I wouldn't lose heat from these areas or the cold wouldn't hit me. They even told me to wear a scarf if I opened the fridge door, and the recommendation was that I use wooden or plastic cutlery, that even the metal in my hands would start off the tingling in my fingers. And so I had all of that. The nosebleeds, I would say, got worse. So I had the first session, the drip, came home, started the tablets, and the tablets were horrid. Yeah, I had all sorts of symptoms, changes in sort of how my bowels were not functioning, dizziness. I had it all, the dizziness, the lightheadedness, the nosebleeds, and just the tiredness. I remember my sister was looking after me as well, and she came in and said I looked grey one day. I just didn't have the strength to really do everything. And then from there on, it was a cumulative effect. That's what they called it. The chemo would be cumulative. So my last scan, which I had in July last year, I was no evidence of any active disease. So don't even call it remission. I've got no disease whatsoever. So I'm on a 10-year watch list now, because there is this can come back. The longer I can make it without it coming back, the better for me it is, in that the probability of it coming back after 5 years lowers even more. So I had to have initially, because of the way I'd healed, and I had some scarring on certain areas near my liver, because of the way I healed, they wanted to keep an eye on that scarring tissue, because the likelihood of, if this comes back, what it likes to do is hide in those scarred areas, or hides in your belly button. So I've had my belly button removed, which is really odd, because it likes to hide in those little scar tissue areas. I didn't realise that I had PTSD, which I've been sort of diagnosed with, until I put on the fan the following year. So 2023, last year in summer, it was really warm, and we pulled out the fans on a night, on an evening. And as soon as that fan went on and that whirring noise of the fan went on, I just could smell the chemo. That's a really odd thing to say, but the chemo has a specific smell, and I could smell it. And I knew straight away that I was on this downward spiral. So a year later, all this trauma started to come out. And I think my mental health now is, it's not a linear trajectory, I wouldn't say. It goes up and down. So you need to be really aware of it. That's what I'm noticing. There are still some programs that I can't watch with my daughter on silly things like Netflix, because I watched that when I was on chemo. So even the other day to my daughter, I said, there's a show that Sophia, my daughter, absolutely loved, and we watched it together. And I'd just be laid on the floor and we watched it together. And I sort of said to her the other day, I think we need to watch it. And she said, Mummy, are you sure? And I said, yeah, I think we need to watch it. Just because I feel like I need to get over this feeling of where I was at that time. So I think it's still a work in progress. I've signed up for the Great North Run, which is half a marathon. So I'm trying to do things in a really positive way. I had to defer it last year. Me and a friend were doing it who had a similar diagnosis. And so we're going to be doing that in September again. And my boys have said they'll raise money as well. So we're doing it all together. So I'm looking forward. I have compartmentalized. I know I'm not quite there with my mental health, but I'm a get on and just do it girl. You know, I just know, you know, for the kids, I just need to get on and just do it. So I think it's day by day still. I would say as a female, and even for my intersectionality at the moment as a South Asian female, I would say don't underplay, or don't, you know, think, even as a mum, you know, don't not make time for yourself. You have to make time for yourself. You know your body the best. And if it feels like it's not doing what it should do, or you feel like you're going into a next phase of your life, you need to be your own health advocate. And so I would say, listen to your body. I would urge women to really understand sort of menopause, perimenopause, and talk about that openly with their children, with their daughters or children. Because I think we need to be our own advocates. And I think you have to put yourself first. It's like that thing, you put your own mask on first, don't they? When you're on an aeroplane and they're doing all the safety checks, it's about putting on your mask on yourself. And I would say that certainly, I've learned that. You know, work could have replaced me. You know, you're not indispensable almost. So put yourself first. I think first and foremost is be your own advocate, especially as a woman. Listen to your body. And I know menopause in the UK is now the rage, and HRT is the rage. Everyone's talking about it because I think women have had a bad deal. But really get to know your body and fight for your own health.